It's your time to live well, and you have tuned into the Holistically Speaking podcast, where we're teaching you to be well and be whole in your body, your joy factor, in every season and pivot of your life, in your mental health and your well-being. Are you ready for this episode? Excellent. Tune in. You won't be disappointed. Absolutely. You will not be disappointed. Hello, everybody. It is your well woman, practitioner LaShanna Leonard Moore of Holistically Well. And this is my episode, another episode in the podcast, Holistically Speaking. Yes. And I am so excited to have you a part of another episode of being well and being whole. That's what it's all about. That's what we're learning how to do. And through this platform and this opportunity, by sharing with you both on the Well Life TV as well as the audio podcast, Holistically Speaking, I have an opportunity to give you information, to give you wisdom, to give you tools to put in your well-being utility belt. I'm a Generation X girl, so I thought about Batman right there. Put in your utility belt to learn how to live well and whole, not just for today, but for every day that we have on this earth. And that's what it's all about. Well-being is not a destination. It is a lifelong journey, and that journey can be enjoyable. It has all of its terrains. It has its ups and downs. It has all of its climates. But with the mindset and the spirit to be well and to be whole, we have what we need to journey and to make that happen. So I'm so excited to have you a part of this episode. Listen, we're going to be talking about, it's a big bag, as I mentioned on the audio, as well as the description of this topic. It's a big bag. It's a loaded one. It's not absolute. It's not conclusive. My disclaimer here is that this episode is not meant to treat, to cure, or to diagnose. Okay, so I want you to take a look at this, because this is what I believe. With that being said, come on in. We're getting ready to have great conversation. Thank you for all of the wonderful feedback that you've been providing me, and make sure that you have subscribed to both platforms, that you watch these. Take the time to tune out everything else. Slow down your rhythm so that you're just not in the impulsive mood to scroll, and listen to this information that's going to change your life. Before we get into this conversation, as you know, I have brought back our moment of WEtreat. That means we are retreating our way, and you are familiar with the term that I pinned, which is called Wellnass. Wellness is doing wellness our way. So excited about it. And because of that, I have even created a retreat that's coming up August the 5th. If you are in Houston or the surrounding areas, I want you to come and join us. We're all about, or it's going to be all about, what we believe: mental health, well-being, lifestyle, some fun stuff, some spa stuff, baby, some good food. Do you hear me? Some good food. Y'all know I'm a foodie nutritionist, so it's going to be some really good food and all kind of good stuff. And I want you to come and spend this time with us if you can, August the 5th. The link is in the show notes, so make sure that you register. We've got some specials going on right now. If you want to join the volunteer team, thank you in advance. We're going to need you. And there are I think maybe one more spot, and that's at the time of this episode, if you catch it live. So please run to the website and check it out. I think there's one more vendor opportunity, and there are opportunities to become a sponsor, for us to partner up, link up, have opportunities to network, to expand what we do and who we are, so that many, many people can be exposed to that. It is definitely important. So there's a lot to consider when it comes to the Wellness retreat. I'm so excited about it. So from that thought, WEtreat, I have brought back us having a moment of retreating where we take the time to stop the impulse and the rhythm of everything on the outside of us and just breathe. And I always encourage you to do these, participate in this moment that you have with me, to do this in real time. Don't just wait for it to be over so that we can get to the next thing. But you will never realize how much a moment of taking a breath means until you actually do it. So I want you to relax your body. You're going to have a moment on your own to inhale through your nose and to exhale through your mouth. And you're going to relax your chin, relax your chest, relax your shoulders. I want you to relax your forehead. Take a deep breath in and exhale deep. I'm going to put on some music for us as we do this, just to kind of get us into that zone. And deep breath out. And just relax. I want you to get the experience of having your exhaling moment. That's what this space and these moments are also about. My music was queued up wrong, but I hope that you still did it. I hope that you took advantage. And I believe in live, so it is what it is. I'm not going to start over. I hope that you took advantage of that moment, though. And if you can do yourself a favor, this is what we call elevating our well-being. It's not just about I did a talk months ago about us living in bumper sticker. We have bumper sticker jargon and verbiage, and that we talk with these nice, cute, one size fit all, poetic, linear phrases and quotes and posts that we see as if just the quote itself, the words itself, makes things better. And that's not true. It takes time, it takes patience, it takes repetition, it takes grace and space and flexibility for us to learn what our lives need every day, every moment, every season, every decade, and so forth. And so I want you, and I'm going to challenge you to elevate your sense of well-being, your sense of what it takes to live well. I want you to take what you read and what you see deeper than that. Go under the surface, not just the superficial thing, because it's not always about a feeling. Here's the thing about being well is that it's often challenging. It's hard. It's emotional. It requires all of you to do those things. This talk that we're having today about hormone replacement therapy, that I'm going to be sharing a lot of information with you, I want you to consider that it's not always a first time go around success type of experience. I tell my women, give yourself 3 months, 6 months, a year for just the simplest thing, so it seems simple. Not always that simple. Give yourself time. So I want you to go deeper when it comes to your well-being, and just not to just take things by face value, regardless of who you may watch, follow, believe in. And hopefully they are sharing these types of words of wisdom with you as well. Shall we go into our conversation? Let's do it. So we're talking about hormone replacement therapy today, also known as HRT. Moving forward, just to shorten the term, I'll be referring to it as HRT. HRT. This is a big, big bag because, as I said before, it's not a conclusive or an absolute matter. It's not a one size fits all. As with anything, and as with all things that I share with you, I want you to approach it from an individualized and a personal care perspective. The second thing that I want you to do is to make sure that you are having conversation with qualifiable, trustworthy people that will talk with you about hormone replacement therapy. Let me put my name on the screen so that you can know who I am. You've got to have somebody that you trust. Okay. You want to have someone that you're having this conversation with and that you trust that they're going to give you information that is going to go a long way for your sense of well-being. So, HRT is no different than anything else. There are natural methods, there are complementary therapies, um, there are medical and conventional routes to go and to consider, but it's going to be at the end of the day what you have allowed yourself space to try and see what works for you. I'm just trying to get my name up here. All righty, let's do that. So let's start number one with understanding what this, there you go. Let's start by understanding what this is all about. Hormone replacement therapy is therapy, different treatments, we'll talk about that in a minute, that are advised or administered to a woman when she's going through the pause rite of passage. You've heard me refer to it as such: perimenopause, menopause. Estrogen and progesterone are declining as the norm of what happens in this rite of passage. And so as you're losing those essential steroid hormones, replacement therapy may be an option that you want to consider. Also, I don't want to take for granted that you understand what estrogen and progesterone do. They are essential steroid hormones that are for our growth and our development benefit, not just for puberty or menstruation, but for sexual health, hormone health, uterus for women, testicular health for men, everything as it relates to how we do, what we do, how we grow, how we age, how we move, how we feel. Some of those symptoms that you feel as a result of the pause phases is a result of the decline in the estrogen and the progesterone. So they are essential. Estrogen can also be referred sometimes as oestrogen. Because of those declines, we need to find them in various forms. And that will always be based. Remember what I said, this is individualized. Anything you hear me say, that's also, this information is also based on where you are, what current dis-ease you may be warrioring yourself through, because I consider you as warriors, whatever it is that you're journeying through. Predisposition, any hereditary issues that are in the family or that you have been exposed to or that you are journeying through will also determine whether or not HRT is for you. But the purpose of HRT is to help our bodies to receive some sense of estrogen or progesterone. It also is based on, it's going to be based on whether you have had a hysterectomy or a disease that you're going through, various cancers that are my cancer warriors out there, as to whether or not you can be approved or recommended to have an HRT. Here's the other thing. I feel like this is going to forever be a controversial topic, as many, so be it. This is why this is a form of education, but it has been said that some HRTs can be linked to breast cancer. All of the different criterias that I just mentioned is a reason for you to have distinctive, deliberate conversation with your physicians to make sure that they are aware, which they should know you well enough at this point to know what you should or should not do. Some of you may be a candidate for it and some may not. Pregnancy as well, you may not be a candidate. If you've had ovarian cancer, breast cancer, certain types, cancers as well, pregnancy, uncontrolled high blood pressure may be another reason, and other forms of dis-ease. When you have these conversations with your doctor, and they should be aware of your history. I'm wearing my black body shirt for a reason. Conversation, which is our big takeaway. Advocacy, when you get into these rooms, have the talk. And if you're not a very vocal person, rehearse it. Figure out how you need to share your concerns. Try very hard not to be intimidated. Your doctor, whether you have 15 minutes with them or 30 minutes, is there for you to have your questions answered, to have your anxieties reduced, and to be affirmed by what you are feeling. We're also going to talk about the systemic issue and why we don't need to dismiss that. Happened in the 1600s, happened in the 1800s with the Black slaves, and it's happening now in the 2000s when you have certain experiences, Black and brown women in the healthcare space. If you have not seen Black bodies, stop what you're doing. Save the link that I put in this show, in the show notes, and you need to watch this installment. I'm trying to make sure that this first installment has a fair run and that it has circulated as much as we possibly can get it to circulate before we go to the next installment, because this conversation is about your health and how to approach and the experiences that women have had. And we want to make sure that you are equipped. Put this stuff in your well-being utility belt, right? So make sure that you see, that you watch the film. It's available on live stream. You pay whatever you want, and we can have joint and harmonic and unified conversation, because you know exactly what the film represented and how it is alerting you and educating you, as well as inspiring you. It's full of inspiration. Feedback that I've received has just been wonderful, and I just want to thank you. I have to take that sidebar. If you know me for taking meaningful detours. Excuse me. So thank you very much for those of you who have caught the film so far. I appreciate it very much. But the takeaway from Black Bodies is the advocacy. Learning how to articulate yourself with your doctor. Write your questions down. Write down what's going on with you so that you understand your patient rights and what you have the right to ask when you get into the doctor's office. No question is a dumb question. I'll say it again. No question is a dumb question. Third time. Repetition of mother's skill. Applied knowledge being power. No question is a dumb question. I don't care how old you are. Stick with me here. We're on a journey. We've already left the runway. We're going somewhere. Listen to what I'm saying. I don't care how old you are, what you learned, what you didn't learn, what you think you should know, and what you don't know. Ask your questions, okay? So we're talking about this. We're talking about hormone replacement therapy, and how we can get you to benefit from it if it is for you. Hormone replacement therapy varies by treatments and modalities. It may be a cream, it may be done oral, it may be an actual treatment that is applied to you. And most of the time, your doctor will decide how long you need to be on it. You can stop it at any time. Another Black Bodies moment. If something doesn't feel right, if you don't like the side effects of what's going on, let your doctors know. Let's stop normalizing pain and soldiering through and suffering through things. It's not normal. Your birthright, all women, talking to all of you, your birthright is for you to be able to speak up and for your voice to be heard and respected, and for your wellness team, your health team, to move on it when you say something is not right. You've been in this body your entire life. Regardless of what paper you have or don't have, credentials you have or don't have, you are your first doctor. So if the therapy, the treatment is not going well, or you don't like the way you're feeling, number one, voice that with your physician, with your doctor. Some doctors, based on the therapies that they choose, will choose a fixed treatment. Some of them will cycle you off and on or wean you off. But if it's not feeling right to you, then say so. Drink for today is brought to us by grapefruit juice. Grapefruit juice. Listen, and I'm journeying with you. I'm in the perimenopause phase, and you know, we're learning how to get along. We're making amends with each other. I'm having conversations with her all the time. We're gonna be friends before this is all up. We're gonna find some peace and some harmony together. Okay? but I'm giving myself much grace and space in the process. And that's what I want you to do. Some of the side effects of menopause, which may be the reasons why you go to considering HRT, are the hot flashes, the night sweats, the cold sweats, the brain fogginess, the low libido, the dry vaginal dryness, a lack of sexual. My hair is dripping. It was a wash and go situation. Um, dry vaginas, low libido, all of those things, you don't have to live with that. When we talk about our elders and what they went through, and we don't really know why they were, why some of them slept in separate rooms or they had a lot of kids, but 15 kids doesn't necessarily mean you're having a lot of sex. It just means that you had sex 15 times, right? Having 8 kids don't mean that you were bumping and grinding a lot. It just meant that you had sex at least 8 times and got pregnant those 8 times. So we don't really know the health, how healthy our elders' sexual lives were, and why they were sleeping in different rooms and all of those kind of things. But this doesn't have to be, your experience doesn't have to be like that. They did the best they could with what they had. So now in an age of information and elevated action and all of this good stuff that we have going for us, let's take that on. So any of those symptoms that you're having, those may be some of the reasons why you may consider hormone replacement therapy. Let me also say to you that, let's see, I did the estrogen and the progesterone. I want to make sure that I give you all of the information that I had intended to do. I'm going to also include in the latter part of this talk a special segment for Black and brown women, because as I've shared with you, it is important. There are some things that are different. And what I have started to recommend for my ladies that are going through the pauses, rites of passage, is that they look for physicians and healthcare practitioners that are familiar with caring for menopause. This is why doctors are not required to know a lot about menopause. That is not a part of their curriculum. And they'll tell you this. I have colleagues that are physicians. They're not required to know all of these things. So we assume they know because they are doctors. So they may give you some really simple stuff that you don't feel like is enough, or they may refer you. If they refer you to a specialist, that's great. You need to know about that specialist and you need to know why. If you're having a conversation with your physician about the symptoms that you're feeling and about HRT or menopause in general, you need to make sure that they are well versed in menopause health. So I've started to make sure that the women that I work with are seeing someone that is specialized. With that being said, I have a resource that the society goes by NOMS, and I'm putting them in the show notes as well. I love them. I trust them. The North American Menopause Society, you can use them as a resource. And on their site, they have a link where you can find a menopause specialist in your area. Can I get some for that? Wellness, honey. Yes. Because you don't have to struggle. You don't have to do, a random search. Black Bodice message talks about making sure that you have developed and structured your team that's all about you, that's just for you. And it's not always Black. For Black women, it's not always just the Black. We've talked about that. We know that. The old school doctors, we don't need to dismiss them. A lot of them have a lot of good knowledge and years of maturity in their specialties that we don't need to dismiss them as well. Holistically well, through the work that we've been doing, all of the causes and the great chaos that we've been causing and the call to actions that we've been doing, we have garnered some great white alliances, and I'm thankful for them. This information doesn't just need to circulate within our niche and our community, but in order for us to make local change, national change, legislative change within the healthcare industry, we have to have people who will have a little bit more influence than us, if that's what the time calls for at this moment, until our equality start equalitying. then we gather that support and that help. And so I'm very thankful to have it. So make sure that you are involving everyone in these conversations about what needs to be done. And for those who are on the front lines, who are not Black and brown, who are willing to help us, we are thankful, we are appreciative, and we definitely accept it. Let me go to now, as we go to the other half of the second half in the wrap up of this part one, because part two, I'll have a hormone specialist to join me. Look, this is a big bag. All of you have had a different experience, or you're curious, or you're considering, or you've heard about other experiences, whether it was a doctor or another patient or a peer. And so I want to move into how this hormonal experience has varied by race. I want to thank my physician friends from the University of Chicago, the medicine sector in particular, that talked to us, as well as a study that was done on women across the nation being the United States, regarding hormonal therapy and replacement therapy, HRT. And in essence, in short notes, cliff notes, it was discovered that, number one, white women enjoyed and benefited from the therapy. Black women and Latina women were a lot more hesitant, and they also received a smaller dosage, as well as Black and Chinese women and Indian women as well. This is from the University of Chicago. The survey and the research is public, and I'll include it in the show notes in case you want to take a deeper dive into it. And I thought that was very interesting. Now, this is where I'm circling back, and I'm talking about the systemic issue that we have and why we cannot be so quick to dismiss it. This is also me circling back and talking to you when I talked to you earlier about how physicians are not required to learn certain things. It's not in their curriculum. Those two things being combined, and this is a 16. This issue is centuries old, from the 1600s to the first documentation of female slaves being tampered with in the 1800s, and now 2000. It has not changed. Sure, things have improved. Some voices have been heard. Advocating is going great and strong. But in our personal day-to-day experience in this realm, healthcare realm, we have to make sure that we're making the connection as well. And so many of you talk about the neglect, the dismission, or the disrespect, or just not being taken seriously. This particular survey, which I think over 1,200 women were surveyed, the women that were hesitant, when we look at the systemic issue, and you know your history and even your personal experiences, how morbid or how grave they may be, and your loved ones, the grave situations of your loved ones, it is obvious why a lot of melanin women are hesitant to try different modalities or different suggestions. So you need a doctor that is sensitive to that. Also, what they discovered in this particular survey is that the Black women who were Black and brown women who were administered a therapy were administered it automatically at a low dosage. Now, sometimes it is normal that your practitioner is going to start you at a low dosage, watch you typically for about 3 months, look at the trend, see how things are going before they change anything or up the dosage. But because it was assumed and wrongfully considered that the Black and brown women could handle the things, the pain and the anguish and the anxiety of what we're dealing with, they automatically gave them a lower dosage. And so that's just not going to be acceptable. It's not going to be acceptable. The doctor here, Monica Christmas, she's a medical doctor and an OB-GYN as well, is the one that is reporting this particular survey, and said that, sorry if the screen goes blank at times, referring to a note from Dr. Christmas, said that they recognized that their particular clinic needed to integrate some new modalities and needed to consider another approach to HRT when it came to dealing with Black and brown patients. And I applaud them for that. I truly, truly applaud them for that. We need much more of that. And until we all get it, until equality will do its thing, we're the voices that have to make sure that they're heard. All right, so deep breath, Selah moment here. We've talked about what HRT is. We've talked about who qualifies and who may not qualify. We've talked about estrogen and progesterone, what they're doing in these pause rites of passages, and why HRT may be a consideration. We've talked about the different cycles, how you can stop if you don't like the side effects or you're just not feeling it. You have the right to do that. We've talked about the importance of the healthcare team. We've discussed the importance of having a physician or a team of people that are clear and qualified and familiar and well learned, or as some people say, learned in menopause health. And then the alternative therapies, as well as the type of therapies, be it oral or treatment or skin, gel, patch, cream, all of those different things that may be administered, the dosage level. We've covered quite a bit in this time frame. I'm always looking at my time to know how much time I have spent with you. And we'll have the part 2 with the hormone specialist. I'm excited about her joining us. That's going to give you first class information on whether or not you want to consider HRT. And then just from the office of a special physician that practices hormone health. We want to hear from her. We have also qualified the care and concern of Black and brown women in this space and in the HRT debate. And I think we've covered quite a bit in this. So with that being said, I want you to, of course, send your feedback. As some of you do, I'm so thankful. Your comments, your respectful comments. I'm okay with people agreeing to disagree as long as it is respectful. I don't delete comments or feedback just because it doesn't echo what I say or teach. I want you to be thinkers. And I think those of you who are audience members of Holistically Speaking definitely do that. So we will come back with part 2 of HRT. Make sure that you have subscribed, that you are following, and that you share. Why is that important? It's important for several reasons. And as we get ready to hop off, it helps people find us quicker in the URLs, whether it's Well Life TV or whether it's the audio. People are able to find us quicker. And if you have appreciated this information, we want others to appreciate it as well. All right, my friends, as always, be well and be whole. Thank you for watching, and catch the audio version as well. There is always something on one or other platform that may not have been included on the other one, and that will maximize your life. Until the next time, be well, be whole.